Arby's, we have the meat.
We are hoping to make you feel empowered this morning if you or someone you know is either a cigarette smoker, a cigar smoker, or sadly, if you're a teenager vaping right now, you know how difficult it can be to convince someone or help someone on the path to quitting. So luckily for us, Jordan Armstrong is on the show this morning. She's with the Hamilton County Health Department. She is a public health educator, but you're specializing in the tobacco and nicotine.
Yes, ma'am.
And we're on the cusp of a very important week statewide, which is the Smoking Cessation Week.
Yes. So it's state of Tennessee's 8th annual Tennessee Quit Week. The theme this year is it's quitting time in Tennessee. In the state of Tennessee, 31 lives are lost each day to a smoking-related illness. And so the goal of this whole week is to try to encourage Hamilton County residents, specifically state of Tennessee residents, to start that quit journey.
You want to share a phone number because it's just the easiest thing for people to write down.
Yes.
And
that is 1-800-QUIT-NOW. That is a free resource for all Tennessee residents, 13 years and older. They can go online and use the online service. They can call or they can text. It's a free cessation service where they're set up with a personalized quit coach.
Things have changed so much. So in my day, it was just, did you smoke a cigarette or not? But now there are so many other ways you can get that nicotine. Is the vaping still a big problem?
Yes, it is still. There's been a slight decrease since the COVID pandemic, but it's still very much a prevalence.
Is part of the problem that people think it's okay?
Yes, oh my gosh, and that's what I run into all the time. I'm constantly hearing, oh, well, it's safer than smoking. On a harm reduction scale, while it's not as harmful as your traditional combustible cigarettes, it does still very much fall on that harm reduction scale. And unfortunately, the way the FDA has marketed it as a safer alternative, people hear safe, and so they assume that it's okay.
Also, do we really know? Because it's relatively new still. How do we know?
There's still, obviously we know that smoking and inhaling anything into the lungs is not going to be great for your health.
Right.
But long-term benefits-wise, it's still very much unknown with vaping.
It's really amazing to me because a habit is a very difficult thing to make. It's also a very difficult thing to break once you have it. So I'm not trying to act as if it's easy to quit smoking, because that's what I hear time and again, is how almost impossible it can be.
Yes.
People probably try a number of times before they're successful.
On average, it takes anywhere from 6, 7, even 8 attempts to be successful, depending on your usage. And nicotine, a lot of people don't view it in this way, but it is an addiction. It is priming our brain for constant rewards, and so that's what's making it so hard. It's those withdrawals, it's those cravings that have primed our brain to think that smoking is good for us, and that feels good.
If you know someone who has stopped smoking, you should really give them a big round of applause, because I've had a number of doctors over the years say that it is more addicting than a heavy narcotic.
Yes, it's just as addictive as cocaine and heroin. So it's a very hard addiction to kick. So yes, absolutely. If you know somebody that has successfully quit, give them a round of applause, pat on the back. Absolutely.
You are not a believer either in a one-size-fits-all method of quitting, correct?
Correct. Everybody is different. Everybody's brain works differently. It's hardwired differently, and so usage looks different in everyone as well. Somebody that is a heavy smoker or heavy vapor is going to have a little bit harder of a time versus somebody who maybe casually smokes or socially smokes. Granted, it's still going to be difficult, but it's going to be a little bit harder with those cravings, those withdrawal symptoms.
How do you define like a heavy vapor? How do you define that?
It's hard because a lot of people that vape aren't really aware of their own usage. They're not really keeping track of how many times they're hitting their vape a day, how many pods they go through. It's not as easy as, oh, I smoke a pack and a half a day, or I only smoke, 3 cigarettes in the morning versus, the rest of the pack in the afternoon. It's a lot harder for people to
see it.
Yeah, it's a lot harder for people to identify their usage, and so that is a big barrier.
Aren't they kind of expensive?
It's definitely not cheap, that's for sure. And that's one of the things we talk with people about with their usage, trying to let them see how much money they'd actually be saving, by cutting back on that habit and quitting ultimately.
It's interesting to me that, I'm sure all of us are very protective of our phones or your car. You go out of your way to protect the investments that you have. Your lungs, I'm an asthmatic, so I know this. Once they're damaged, they're damaged. You can't repair them.
Looking at a scale on a timeline, once you stop quitting, your lung function improves, but just like you said, it doesn't completely heal itself, but it will improve eventually.
Yes, I mean, you don't want to say, okay, well then what's the point of quitting? It's just that becomes your kind of your baseline, but you can reach a point where you do so much damage, there's just not a lot that can be fixed for it now, and what a shame that would be to do to yourself.
Yeah, and it's hard to get people to understand that, especially those that are like, well, I've been smoking for this long and I already have, I already have COPD. What's the point? I'm going to die anyways. And we can make choices to help us manage our symptoms, to help us manage our illnesses so that we can live a little bit longer.
You said something about being 13 and up. You can call that number.
Yes, ma'am.
What's the average age? Do you know of people? I know I'm throwing you a lot of questions.
Not offhand, I don't, but I do know that it is primarily mostly 18 and older that are utilizing the quit line. Not to say that there aren't teenagers that aren't, but there are other resources.
But I mean, in terms of when the usage starts, do we know?
I mean, 90% of your average smokers, 90% of smokers started before the age of 18, and so it wouldn't surprise me that a lot of them have been smoking before them.
You talk to any middle schoolers these days, and they'll probably tell you that they see it in their world, the vaping.
Yes, when I get to go into the schools and I get to provide education to youth and young adults, and it's one of my favorite things to do because I love asking them, well, what do you know about vaping? What can you tell me? And a lot of times the knowledge that they have, I'm just like, well, that's great that you're so knowledgeable about it. Let's talk a little bit more about it. But the knowledge that they have already is crazy.
And it's very hard because those kids, especially, having a vape is as much of a status symbol as having an iPhone.
Yes.
And they don't know what to do if they don't have one. Even if they don't want to use it, they want to have it.
And that's one of the things that I try to talk with them about as well is, it's the same thing with smokers. Just having that cigarette in between your fingers is just like
it's like a security blanket, I guess.
And that's one of the things that we definitely try to address when we talk about cessation, when we talk about providing education. It's not just the physical aspects of nicotine throughout our system. It's the holding the vape, putting a cigarette to my lips, keeping my hands and mouth busy with those products. That's what's driving a lot of the habits.
Years ago, we were in Indiana, and I had a coworker, and he and his wife quit smoking, and the money was their motivation. But they put their cigarette money aside, and they took a cruise.
That's amazing.
The end of the year.
That's amazing.
So
and what a great reward for being able to quit smoking. And it's important to reward yourself because, like we've just said, it's a hard habit to kick, and so if you're able to kick that habit, reward yourself. Absolutely.
So see, this was not this kind of a conversation to you today if you're looking to kick the habit. This is a cheer you up, yes you can do it conversation. So here's that number, write it down, 1-800-QUIT-NOW.
Yes, ma'am.
You can find all types